Hey, welcome back in. In today's Ask the Doctor segment, we are talking about staying healthy while pregnant, and we are working on, we're having some audio difficulties here, so we'll just be honest with you and let you know what's going on. But Dr. Cindy Jones is our guest today. She is from Brookwood Hospital. And I tell you what, you guys let me know if you guys want to work on this, and we'll go ahead and go to the callers, or we'll come back to this. What do you want to do? Okay, let's tell you what we'll do. We'll just spend some time here chatting for a second with Dr. Jones, and hopefully we can get our callers on the line because we already have them lined up. So how are you today?
I'm doing just fine.
Good to see you. So what's the most common question oftentimes that pregnant women have?
The most common we get is, when is this baby coming?
Yeah, really. All right, I think we're getting our audio together here, but and every pregnancy is different. There will be a lot of things that a lot of women have in common, but there'll be a number of things that are just unique to that woman, right?
Yes.
All right, let's see what Stephanie has going on. Stephanie, you there?
Yes, ma'am.
Hey, go ahead.
Hi, I'm 14 weeks pregnant today, and I'm due in October, and I was offered to play on a slow-pitch softball team this summer.
Yes, and you want to know whether it's safe?
Okay. We lost her. That was one of the most interesting questions ever. I hate that we lost her.
Slow pitch.
So she's, I just want to know, is that safe for her to do, right?
It should be safe. Exercise is safe during pregnancy as long as your heart rate stays 140 or less. We don't want sustained excessive exercise, but short bursts seem to be okay, especially if once you're out of the first trimester. So I would think slow pitch softball now. It's been a while since I've seen it. I don't know if you have to slide into base or anything. That I would not
Probably
recommend.
wouldn't be a good thing to do.
Yeah, not a good thing, but
I guess the biggest concern would be if you're batting, if you were to get hit with the ball or those type of things.
It would be, the baby's pretty protected early on. It would be hard for just a ball. Now, if a bat hit you, that would be different. But hopefully you'd be the only one with a bat if you're batting. So, you know.
All right. So that really comes to the judgment of the mom then.
Right.
Okay. All right. Who's our next caller? Franklin, I'm sorry. Portia? Hi, you there?
Yes, I'm here.
Go ahead with your question.
If you've lost 5 babies, do you recommend actually still working after that?
If you've lost 5 babies?
Yes.
Do they know what the cause of the miscarriages are?
It started with preeclampsia, but the other ones after that was kind of iffy. They really don't know.
Okay. Were they full-term pregnancies?
About 6 months.
6 months.
Goodness gracious.
With losing 5 that way, I probably honestly would not work. I don't know that it would make any difference at all, but I think you would always wonder whether it did, even though it probably wouldn't have an impact. I probably would not work. We don't know that bed rest helps. There are some other things you can do to help lessen the risk of miscarriages. But they wouldn't really prevent preeclampsia, so that can be very serious.
Explain preeclampsia.
Preeclampsia is a condition where you have blood pressure issues. Usually it occurs later in pregnancy, 3rd trimester. The earlier it occurs, the more dangerous it is, and the more likely it is to recur in future pregnancies.
Yeah, like I was put to bed a month before my son was born because my blood pressure went up for safety reasons.
Right.
But that was just 1 month left.
Right.
Okay, Alexandria is on the line now. Hey, Alexandria, how are you?
I'm fine.
What's your question?
I just discovered that I was pregnant 3 days ago.
Congratulations.
And I just wanted to know, why am I cramping? Like, it's a lot of abdominal cramping. Is that normal?
Sometimes cramping can be normal if you have not had any bleeding. Depending on how far along you are, what I like to do with my patients is when they're far enough along for us to see a heartbeat on an ultrasound, I like to go ahead and get an ultrasound then, just because once you see a heartbeat on an ultrasound, your risk of miscarriage, it can still happen, but it's a lot less likely to happen once you see the heartbeat. Now, cramping can occur naturally in some pregnancies due to your uterus growing. You can have something called round ligament pain, which as it's growing, it stretches that ligament, and that can cause a lot of pain.
So usually it's nothing to worry about.
Most of the time, cramping alone is not.
But should she go ahead and tell her physician, though?
I would go ahead and see the physician. They can, you know, if there's any concern, they can check hormone levels, even if it's too early to see a heartbeat. Normally, you can see a heartbeat after about 6 weeks of pregnancy.
Okay. All right. All right. Thank you. Do we have another caller, Franklin? All right, that'll be the last of our calls today. Thank you guys for hanging in with us, for having our technical difficulties. We appreciate it. And Dr. Jones, thank you so much.
You're
as
welcome.
well.
You're welcome.
All right.